All right, here we go. We are live, we are live, we are live. Okay, hello everybody. It's Dr. Alex Earl, and we're here at Pure Plastic Surgery, and it's Hump Day with Dr. Alex Earl. And I just want to remind you guys that now we are on multiple platforms. So you can see me here on IG, the original, okay? So IG Live, but we're also on TikTok Live as well as YouTube. So any of those platforms, you can come check it out. Okay, so this is a time that I get to spend with you guys, and of course I will answer all of your plastic surgery related questions, and we can go over plastic surgery topics, and it's all about education and communication as well. But before we get started on today's topic, which I think is very, very important, it's actually trending. It's one of the TikToks that we did recently, which has got a little bit viral there, about 100,000 views on that one. We're going to be talking about Chemo Level and just kind of delving into that, because we got a lot of questions, a lot of comments on that TikTok. So we're going to dive into that here today. And then of course after that, I'll be happy to answer any and all of your plastic surgery questions, whether it's related to Chemo Levels or really any topic in plastic surgery for any procedure, pre-op, post-op, during the surgery or anything else. Also questions about myself. You want to ask me about my training, and my education, my experience, happy to answer that. But before we delve into all that, we got a very, very cool surprise for you, okay? We got a very, very cool surprise for you. Actually, we got a couple surprises. One is, but there's one that I'm really kind of excited about. But before the big cool surprise, I want to let all you guys know that we now have PatientFi. PatientFi is a way to finance your surgery. They are awesome. We've been talking to them all day today, actually, and getting all our training and onboarding. So our coordinators are all on top of it. And so starting today, PatientFi, 100% available at Pure. It's a much easier way to get your surgery financed. It's easier to care credit, easier than Alphion. And I believe one of the cool things about PatientFi is that you can even pay your deposit with PatientFi, which is really cool. All right, so definitely PatientFi, you should check that out. Okay. The other thing, and I'm going to say this in Spanish, but after that we'll switch back to English, pero les quiero dejar saber que de ahora en adelante vamos a hacer un live, un en vivo como este, sobre la cirugía plástica los viernes, ¿ok? Cada otro viernes aquí en Pure se va a hacer el live exclusivamente en español. Así si quieren oír todo esto en español, chequéenos los viernes de tarde. All right? Okay, back to English. And the other thing is, of course, that we're all on all the platforms. TikTok, we're on YouTube, we're on Instagram, okay? But, all right, you're like, Dr. Earl, just tell us what the big surprise is, damn it, already. Okay, so what is it? So we decided that we want to, we want to give something back to everyone that watches us on the lives, okay? So we're going to be doing what we call the live promo, okay? And this is exclusively for for all of you guys, all the followers and potential patients that see us on the lives. This promo is for you, okay? So we call it the live promo, all right? And what it is that you get $500, $500 off any procedure, okay? Just because you've come to check out our lives, all right? So it's $500 off any procedure, but there are a couple rules, all right? So for those of you that haven't filled out your virtual consult form, you have to fill out your virtual consult form online between now and midnight tonight. So you have a little bit of time there, but it has to be filled out today between now and midnight tonight. And how do you do that? Well, you go to www.pureplasticsurgery.com. In there, you're going to see a button that says virtual consultation. Go ahead and click that button. Fill out all the information, submit your photos, hit submit, and boom, all right, you're ready to potentially, to get $500 off any procedure that you're interested in. Now remember, when you're filling out that form, in order to not get like an error message, you have to make sure that absolutely all the fields have been filled in, okay? You gotta fill in 100% of the fields. Now, if you're not sure exactly what procedure you want, or you want a combination of procedures, don't worry about it. Just click one of the procedures, send in the form. After that, our coordinators will give you a call, and you can work out the rest of the details, okay? So fill out the form completely, submit your photos, okay? And then once you do that, okay, we want to, your deposit should be in by Friday. So our hump days are always on Wednesday, obviously. So by Friday, the deposit should be in. But remember that all deposits here at Pure are 100% refundable. 100% refundable, okay? So there's very little to no risk there. But in order to get the advantage of $500 off, the deposit has to be in by Friday. And how do we know that you got it from the live? Because there's going to be secret password. This is where the fun stuff comes in. There's going to be a secret password, which is going to be different every live. And so you have to mention the secret password in order to get your $500 off, okay? So what's the secret password for today? The GOAT. This is going to be your first secret password, the GOAT. So when they ask you for that secret password, go ahead and tell them the GOAT, and then boom, you're in, all right? Next week, who knows? It's going to be something different, all right? And also, the amount might be different. So that's why you want to keep tuning in. Maybe next week it's only $250, but maybe the week after that, it might be $750, all right? We're going to be playing around with it. And so the amount is going to be correlated to the secret password that day. So make sure you tune in for all the lives, all right? Excellent. Okay, moving on to education, all right? And in case you forget the secret password, I'm going to put it here on top. As well. All right, let's get into it. Hemoglobin levels. Okay, so we did a TikTok, and it was one where I was like surprised that my patient's hemoglobin level was below 11 just before surgery. Okay, why is that important? Because if it's below 11 just before surgery, then unfortunately we have to cancel the surgery. Okay, for pretty much most of the surgeries that we do. So for Lipo 360, BBL, mommy makeover, tummy tuck, really for all the kind of breast lift. All of the bigger surgeries that we do, hemo level needs to be 11 or above. Now, if it's a very small surgery, say for example a straight up breast aug, sometimes they can accept a lower than a hemoglobin of 11, but that's truly going to be on a case by case basis, okay? So how do we check hemoglobin levels? Well, a lot of you know that we do a lot of labs before surgery, and one of the most important labs that we do is called the CBC. CBC, which stands for complete blood count. Complete blood count. And when you do your CBC, you're going to get a whole bunch of numbers. A whole bunch of numbers, but there's really only 4 of them that we're most interested in. 4 of them that we're most interested in. One is the white blood cell count. So the WBC, white blood cell count. And that one, we're just looking for that one to be within normal limits. Okay, whenever you do a lab, they tell you your result, and they put a range there. What's the normal range? If it's within that normal range with your white blood cell count, we're happy. The next 2 are related to the amount of the blood levels, okay? How much basically red blood cells you have in your system. And that's the hemoglobin and the hematocrit, okay? They kind of correlate with each other. So honestly, the one that we look at the most is the hemoglobin, all right? And that's the one that we need it to be 11 or above in order to have surgery, okay? And then the last one that we look at there is called the platelets. Platelets are also very important because they have to do with your clotting. So if your platelets are too low, that means you don't clot well, you can bleed out. It's very, very dangerous. And if your platelets are super high, not just a little bit high, but if they're super high, over 1,000, then that means you clot too much, you can get blood clots and DVTs, the clots in the legs and the PEs, the pulmonary embolus, the clot in the lungs, which is also dangerous, okay? So the platelets also have to be within that normal range. If they're a little bit higher than normal range, typically say like anything below 1,000, we're usually okay with that as well. Certainly anything above 1,000 for platelets, not a candidate for surgery. Okay, so hemoglobin levels we were talking about today needs to be at least 11 or above. Okay, if it's below that, we can't do most of the procedures. Now, what are some things that may cause your hemo level to be low? Well, the most common one is what we call iron deficiency anemia. Not enough iron that you're ingesting, that you're taking in your diet, okay? That's why we have all of our patients start at least 30 days, but actually usually 60 days before surgery would be ideal. You're gonna start vitamin C, folic acid, and iron supplements. Those are the 4 supplements that we ask you to take. So it's vitamin C, folic acid, one's called Hemoplex, one's called Floradix. Those last 2 are the iron supplements that you need, okay? And so therefore, hopefully then by the time that you do your labs, which remember they have to be into Pure, into our pre-op department by 3 weeks before surgery, okay, by the time you do your labs, your iron levels have been boosted up and your hemo level will be boosted up. All right, so very, very important. That's the most common cause. Now, there are other kind of certain blood, what we call dyscrasias or diseases that can cause your hemo level to be low. One of them is the thalassemia. So there's alpha and beta thalassemia, and that can cause the blood level to be below 11. And the unfortunate thing about those is sometimes it's really, really, really hard to get it up, even with iron supplementation. So unfortunately, if you have, fairly advanced thalassemia and we just can't get the blood level to the appropriate level, then unfortunately you won't be a candidate for surgery. Okay? And then of course you have your hemophilias and other things. And the other one is sickle cell disease. Okay? If you have sickle cell disease, your hemo level may be below 11, but also your red blood cells do not form, how they normally should. And so if you have sickle cell disease, you're not a candidate for surgery. Now, if you have sickle cell trait, listen to the difference there. So sickle cell trait, then typically you are okay for surgery. So sickle cell disease, not a candidate. Sickle cell trait, typically yes, you are a candidate. Okay? All right, so what do you have to do, if it's low, or what do you have to do to prepare for surgery? You got to take your supplements. Your supplements are going to be your iron supplements. We typically recommend something called Hemoplex and Floradix, okay? And vitamin C and folic acid. Why the vitamin C and the folic acid? Because it helps, the your body absorb the iron the vitamin C helps your body absorb the iron, and the folic acid also helps it be absorbed and then basically to create what's needed for the red blood cells. Okay, so combining all those things together will increase your hemo levels. Okay, so the other possibility though is if you have like quite a bit of a low iron and low hemoglobin level, then sometimes you could benefit from what's called an iron transfusion. All right. And that's not something that we're going to be providing, okay? You're going to have to get that from your PCP, all right? So if your primary care provider believes that your anemia or your low hemo levels are because you have a fairly severe iron deficiency, then they can give you a iron transfusion, and that'll boost you up fairly quickly, like within a week or so, okay? So that's something that potentially you can do as well, all right? Okay, excellent. So that's basically how we optimize the hemo level before surgery. Now, how do we deal with hemo levels during and after surgery? Okay, those are the two next things. So during surgery, we use something called the cell saver. Now, we use this for your Lipo 360 and your BBLs. Okay, it's not used for tummy tuck. It's not used for breast surgery. Why? Because there's very little. At least in my hands, there's very little to no blood loss for a breast surgery, whether it's a breast aug, breast lift, etc., or a tummy tuck. Those are all open surgeries. I see the vessels directly. I cauterize the vessels. Minimal to no blood loss in those procedures, so there's no need for cell saver. Now, liposuction procedures are different, right? We're using a cannula. Okay, it's a blind procedure. We're potentially going through vessels and whatnot, and so the blood loss tends to be higher. But rather than just kind of throw all that away, once we separate the fat from the supernatant fluid, that fluid has blood in it. So why throw that away? So instead of throwing that away, we recycle it and we give it back to you. And the way to do that is with the use of the cell saver. Okay? Let me see. A lot of you have been following for a while. Let's see who knows the answer to this question. So when we do the liposuction, we remove what we call a lipoaspirate. That includes fat and fluid and blood. When we let that settle, what goes to the top? The fluid or the fat? Anyone answering?
Let's give them 5 seconds.
5 seconds? What's on top? The fluid or the fat? All right. So the fat goes on top, okay? So the fat goes on top because it's actually less dense than water, right? So the fluid goes to the bottom and the fat goes to the top. So what we do is we put like a little cannula all the way to the bottom of the container. We suck out all the fluid, and that fluid has just regular IV fluid plus blood, okay? And that way we separate that out from the fat. The fat, of course, we want to keep because we're going to use that for your fat transfer. And then we run that fluid, okay? We run that fluid through the cell saver. The cell saver is a machine that has multiple filters. And so what it does is that it basically separates the red blood cells from everything else. So if there's, any like little fat cells left behind, any other like IV fluids, anything else that's not red blood cells, it gets rid of that and it keeps the red blood cells, and then it puts them in a bag, and then we give it back to you through your IV like an auto transfusion. It's super cool. And so that way we decrease the amount of blood loss for the patient. So what are some typical numbers? So these are some typical numbers. So patient comes in because with a hemoglobin level, so hemoglobin level of 12, okay? We do a big Lipo 360 case, big Lipo 360 case. Not unusual to drop that to say somewhere maybe around 8. But then we give you your cell saver, and then we boost that back up to 10 with the cell saver, okay? So overall, a lot less blood loss for the surgery. You recover quicker, you recover faster, you feel better. So we highly recommend the cell saver, and that's why we use it for all of our Lipo 360 BBL cases. 100% of those cases we use it for, okay? So that you do better. So that's how we deal with hemo levels during surgery. Now, what happens after surgery, okay? So after surgery, like you saw here, we're still going to drop some, right? The cell saver is not going to get you back to baseline. That's impossible. It can't do that, okay? So we're still going to drop a bit. So we do encourage you then to continue your iron supplements, your vitamin C, and your folic acid, okay, for the first 2 weeks after surgery, okay? So you're going to continue all of those to help your body build back up. To help it, for in this example, help it build back up from that 10 to your baseline level of 12. Does that make sense, right? So we're definitely going to do that for at least the first 2 weeks, okay? And you also want to increase the iron in your diet. So what are some things that have a lot of iron? Actually, what we call the green leafy vegetables. Spinach is a great one. Remember Popeye, guys, right? And then, of course, the red meats have a fair amount of iron as well. And there are other foods out there with higher iron content that you should intake, especially initially right after surgery, okay? Like liver. I know, you're like, oh my God, liver tastes terrible. I know, I think it does too. But if you can add some liver in the post-op, like the initial post-op period, that's gonna help with your iron levels as well, okay? Now, of course, what's the ultimate? Well, the ultimate is a transfusion, right? Now, it's rare, okay? It's rare, but not zero. Remember what I always say, guys. In medicine, nothing is 0% or 100%. So is it possible to do your BBL, have your cell saver, and still potentially need a transfusion? It's possible. Is it common? No, especially with a cell saver. It's not common, okay, but it is possible. So it's rare, but it can occur. So if the hemo levels are low, and for this, typically for most patients, less than or equal to 7. So it's quite low. If your hemoglobin level is less than or equal to 7, we're going to recommend a transfusion. If it's above 7 and you're doing okay, yes, you're going to feel tired and all these things, but overall you're doing okay, like your heart rate's okay. It's going to be a little elevated, but maybe somewhere around 100 or 110, but nothing like 140 or 150. If your blood pressure is okay, and you're up and you're walking and you're moving around, then if it's above 7, we're not going to transfuse. We're going to ask you to increase the iron in your food and increase your supplementation. We may even give you iron pills to take, which is also a possibility, okay? But if it's below 7, we're definitely going to transfuse, and we're going to have to do that in a hospital setting. Or if it's somewhere around 7, but you're just not feeling great, your heart rate's 140, your blood pressure's a little bit on the low side, like 85 over 60, you're just not feeling well, then we'll recommend the transfusion as well, okay? All right, so a lot of information regarding hemo levels, and now we're going to move on to questions. But right before we do that, reminder once again, the live promo. You can only get it if you watch the lives. You don't watch the lives, you don't know the secret password. That's it, you're screwed. You don't get $500 off. It's like like Monopoly, like do not pass go, do not collect 200. It'll be like, do not pass go, do not get $500 off your procedure, all right? So make sure you fill out that form between now and midnight. Get the deposit in before Friday. Remember, it's low risk because it's 100% refundable. Nobody does that. Only Pure does that. 100% refundable because we understand life happens, things happen, all right? We're not gonna keep your money if we don't do anything for you, all right? But you definitely gotta get that filled out by Friday. Use the secret password. Anyone remember? It's right here.
Yeah.
All right, secret password for this week, the GOAT. You want to tune in next week? Next week might be $750. Who knows? All right. Okay.
Friday?
And
Viernes
Friday.
sociales?
Oh, yeah. Well, that word, yes. Viernes social on Friday. Hablamos español los viernes. Okay, guys? All right, let's go ahead. Let's answer some questions.
Okay, first of all, some people wants to say hi. One of them is Jatsi, and she's at YouTube.
All right, Jesse, how you doing? Thanks for following us on YouTube.
Okay, and let's start with this one at TikTok. Can someone with beta thalassemia trait still have surgery?
Right, so yeah, it's one of the ones that I mentioned here where your pre-op chemo level might be below 11, right? So there's different degrees of beta thalassemia, okay? So some people may have a very mild form in which they hover somewhere around 11, especially with iron supplementation. And if that's the case, then yes, we can do the surgery. Now, if you have a little bit more of a moderate to more severe form and your chemo levels are hovering around 8 or 9, unfortunately, even with iron transfusions, it typically won't get to 11, and unfortunately, then we won't be able to proceed with the surgery.
Your BMI requirements, Doc, please remember.
Yes, so a reminder for our BMI requirements in terms of our max BMI, for me, my max BMI is 30, okay? And for lipo, no, not for lipo, sorry, for BBL, because we need to have enough fat to do the procedure, the lowest BMI is typically about 20, okay? 20, 21. So there's a range there. Typically you want to be between 20 and 30. Now, for things such as, because we get this question, a lot of times we get very, very thin patients that want a breast augmentation. Obviously, they want a breast augmentation because they're so thin, they don't have a lot of breast tissue. For those patients, we typically go into lower BMIs, like BMI of 18 is not uncommon for breast augmentation, okay?
Okay, Doc, could you talk about the Exparel shot?
Yeah, great question. So what is Exparel? Exparel is an injectable, something that we inject at the time of surgery, okay? And you can think of it like a long-term, lidocaine. You know that numbing, or Novocaine, that numbing medicine that you typically get at the dentist when they need to numb up the gums? It's similar to that, but it lasts up to 72 hours, like pretty much, up to 72 hours. And we use it for, the most common surgery that we use it for is your tummy tuck, because we have that muscle repair and that very, very, that long incision across the bottom. And so we use the Exparel for your tummy tuck, and then you have much, much better pain control for the first 72 hours post-op. And we have a lot of patients that when they use the Exparel, you don't take a lot of that Percocet, which is great. So they may take maybe 1 or 2, and that's it. Then they switch over to Tylenol or ibuprofen if it's 48 hours after surgery, and there's no need for all the narcotics.
Okay, how long does your breast hurt after a lift or an implant?
So yeah, the good news is that overall the pain after a breast augmentation or a breast lift plus minus implant is not too bad. What you're gonna feel more is more like a pressure. So a lot of our patients describe it like a big pressure in the chest or an elephant stepping on the chest. So you're gonna feel that pressure, and it takes a while for the implants to settle. So the implants will settle in approximately 3 months, but you won't be feeling that pressure for that long. Most patients that have a breast surgery, any breast procedure, they're usually driving within a week. So it's very, very, very well tolerated.
Okay, and doing Lipo 360, can I add the Exparel?
So unfortunately, Exparel doesn't work well for lipo cases. It works well for cases with big incisions. So we can put it, in your tummy tuck incision, your breast lift incision, your arm lift incision. But it doesn't work well with a lipo case because the incisions are very, very small. And so when we do lipo, it's more like a full body type of impact that we have. And so we can't kind of target it with the Exparel. So it doesn't work well for lipo 360 or BBL.
Okay, had 360 lived with mommy makeover and it ended with an infection and needed skin graft.
Oh wow, sorry to hear that.
Yeah, can I have another mini tummy tuck?
So it's all gonna, yeah, I mean, it all depends on how much skin laxity you have now, right? So if you have an area that had gotten infected, right, and then you skin grafted that area, what we'd have to determine is whether the skin, the normal skin, not the skin graft area, the normal skin left behind, if we have enough laxity there to be able to pull that down and remove that whole skin grafted area. So that is definitely going to need like a consultation, like an evaluation on a case-by-case basis. But it can happen. Like maybe this, I don't know how long this happened, but if this happened, say 5 years ago or 10 years ago, that skin can get kind of loose again, and potentially you can come back, get a mini tummy tuck, remove the skin graft area, make everything look nice once again.
Okay, our classic question: will you do a tummy tuck with 360 lipo?
Right, so it's a very, very common question. We probably get it every week. But the answer for me is no. I don't like to combine those procedures. So I don't combine tummy tuck and lipo 360. One of the reasons is that here in Florida, we are actually limited by the Florida Department of Health as to how much fat we can remove when we do a tummy tuck. And the limit is only 1,000 cc's. So for most patients, that's not going to be enough to do a whole lipo 360. I think for most patients, we get 1,000 cc's just doing the flanks and the waist, which is what we commonly do with the tummy tuck. Okay, and then the other issue is, well, if we're doing just lipo 360 and tummy tuck, recovery is not as bad because you can lay on your back, so that's okay. With BBL though, it becomes a problem, right? You can't be on your butt, you can't be on your belly, so it's very, very tough recovery.
Doug, can you have a BBL reduction? You do that?
Yeah, so we're getting more and more of these inquiries, and I think it's going to be like a big, big thing. Because back in the day, I would say at least 5 years ago, maybe more, the style of the BBL is much different than what it is now. So the style of BBL was to go quite simply to go as big as possible. To go as big as possible, make the waist as small as possible, big, big hips, big, big buttock, okay? The problem is that it becomes not sustainable. Unfortunately, gravity always wins. And the more volume you have back there, things start to fall, and it gets uncomfortable also, and the patients start to not be happy with it. The way, the style of the BBL right now, it's much different. The style that we do at Pure, and I like to say that we're kind of one of the pioneers with this as well. We create what we call enhanced natural results, meaning that we're basing the procedure on that patient's very own unique foundation, so that you have a beautiful enhanced natural result that is long lasting. Okay, so I don't anticipate seeing a lot of Pure patients saying 5 years coming back for a reduction. Actually, it's going to be extremely rare. But today, we're seeing a lot of the patients that went to other surgeons or other countries, Colombia, Dominican Republic, they're coming to us for a reduction. Okay, and yeah, we can do that. We can do a reduction and a reshaping, because a lot of times it's not just reducing volume, but it's reshaping, right? Getting rid of that shelf, getting rid of those lats that nobody really likes so much anymore. Okay, so we do that also. There is one very important caveat here, people, that you have to know. If when you had your first BBL, they put the fat into or deep to the muscle, which of course we should not do because it's very, very dangerous. But we didn't have all this information, say 7 years ago or 10 years ago. If they put the fat into or deep to the muscle, we cannot reduce that. Okay? I can then go and put a cannula into or deep to your muscle now, because the same dangers exist. It's too dangerous. It can hit those vessels, cause a fat embolus, potentially death. All right, so we can only reduce the fat that's between the muscle and the skin. So if it's between the muscle and the skin, yes, we can reduce that. Fat that has been injected in a prior BBL into or deep to your muscle, we cannot reduce.
For YouTube, this is low MCHC, high RDW, but
yes,
hemoglobin is 11.6. Is that safe for tummy tuck?
Yeah, that's fine. So you notice that I only talked about 4 things, and honestly, I could probably only talk about 3 things: the white blood cell count, the hemoglobin, and the platelets. Your CBC is going to come with like 20 different lines, okay? And quite honestly, unless you're a hematologist and you're specifically looking at something, we don't care. Yeah. As a surgeon, you know, we're more simple-minded. We just care about these three things. So if the MCW and all that other stuff is off, we don't really care as long as these three are okay: your white blood cell count, your hemoglobin, and your platelets.
Okay, this is a good one. Do you have to have a low BMI for the skinny BBL look? My BMI is 26.4, but don't want to go too big.
Yeah. So at 26, I think you're still okay. I mean, we can still kind of give you that look, that beautiful, enhanced, natural look. Nothing that looks like it's exaggerated or stuck on. Like, we don't want any diaper booties. We don't want any ant booties. But actually, a BMI of 26 is very nice. It's a very solid BMI, and we can definitely work with that. It's hard, you know. That's kind of like the upper edge of what I would call the skinny BBL. Definitely, you know, once you get beyond that, I wouldn't no longer call it a skinny BBL or even a South Beach butt lift. I would just call it basically your standard BBL.
Do you fix tummy tuck scars?
Do I fix them? Yeah, I can fix them for sure. And you know, that we can take on an individual case-by-case basis, and I would have to look at your current scar and kind of also understand, you know, what it is that you're looking to fix. But yeah, that's certainly something that we can do.
Okay, can you do lipo without cutting the skin and do the BBL with my own fat? Okay.
Without cutting the skin?
Yeah, I'm confused about tummy tuck and BBL, I think.
Well, no, okay. So when we do lipo, we do make incisions, but they're all tiny, tiny incisions, right? They're like little 5mm incisions, smaller than my pinky, really. But we do a few of them. So we do about 3 in the suprapubic area, very, very low, very easy to hide. 1 inside the belly button. In the back, there's 1 in between the butt cheeks, 1 in the kind of hidden in the armpit areas. And then there's 2 incisions that are low in the butt crease area for the fat transfer. Those are all the incisions. We hide them. So when you're doing the South Beach butt lift, okay, which are signature butt lift here, only up here, you can only get that up here. All these incisions are extremely hidden, so even if you're like out on the beach in a small bikini, they're not visible, okay? And then yeah, with the BBL, of course, what we do is we use your own fat and we transfer it to your hips and your buttock.
Okay, Doug, can chin, lipo, neck be done without general anesthesia?
Yes, it can. So if that's all we're doing, we're just working on the chin, whether it's lipo or a lot of times we like to add something called face tight. I would really, really recommend that. Face tight is really cool. It helps melt the fat and it helps the skin retract up for a sharper angle between the neck and the chin. And these are procedures that we can do with what we call twilight or MAC anesthesia, meaning that you're just kind of asleep, you're not really aware of what's going on, but it's not general anesthesia, right? You're not to the point where you can't breathe on your own and we have to put the breathing tube down, okay?
This is on fire, I'm keep having questions and...
Let's do it.
Okay, what procedure would you recommend to get rid of tummy and back fat?
Okay, so if you have tummy and back fat, but your skin is fairly good quality, meaning that it's fairly tight, then I would recommend a Lipo 360. That's going to take care of all the abdomen, the flanks, the waist, and pretty much the entire back. All right? So that's probably the first thing I would recommend, as long as you have fairly good quality skin.
Okay. Well, you have a patient that's coming next week, and she
All
will
right.
bring you a present.
Oh, all right.
Her name is Whatsaholic, so remember, show for present.
All right, I look forward to it. Yeah, I look forward to seeing you next week.
Okay, Doug, can you fix severe scarring from a breast reduction that developed necrosis on left severe scars after healing?
So again, a lot of times, yes, we can, especially if it's been kind of several years. I would have to take that on a case-by-case basis, but it's not unusual to be able to do that, to come back and do like another reduction where we're removing all the old scars, removing some more of the excess skin, excess breast tissue, and putting everything back together again. And then, really being really careful with the scars starting 2 weeks post-op with your Silogen or your other, any other like silicone-based scar cream to make sure that you heal a lot better the second time around.
Okay, after a mommy makeover, how long I have to wait for a BBL?
So the minimum wait's going to be 3 to 4 months. All right. Now it can be longer, of course. It can be any time after that, but it shouldn't be any time before 3 to 4 months. Okay. Because we want to make sure that you're healed completely in terms of your breast and your tummy tuck before you then undergo, the second procedure. All right. Okay, everybody. All right, sounds good. I think we're going to wrap it up there. I want to thank everybody for participating. We had a lot of great questions today, and they came from all platforms, which is awesome. So that's really, really cool. All right, so before we sign off, one last time, here we go. The live promo is exclusively for our live viewers because we want to give something back to you guys. We really enjoy having you around, answering your questions. So we're giving something back to the people that watch the live. We're going to give you $500 off any procedure. Any procedure, make sure you fill out that virtual consult form between now and midnight. Then our coordinators will call you and they're going to ask you for the secret password. Secret password, the GOAT, okay, for this week. And then secret password, make sure you put that deposit in by Friday. 0 risk, 100% refundable, and you get $500 off. And acuérdense que el viernes hablamos español porque el viernes el cuerpo lo sabe, okay? On Friday, Spanish lives. And last but not least, Patient 5. Take advantage of Patient 5, people. We're really excited about this opportunity. It's going to make things a lot easier for you guys. Lower interest rates, easier to get than your care credits and your Alpheon. So definitely much more access there as well. Okay, everybody? Well, I hope you enjoyed this. Make sure you tune in next week. There's going to be another secret code then. And I look forward to seeing you guys there. Okay? Take care, everyone. Ciao.